In our last video series, we've shown how important antibiotics are. We're explaining what antibiotic resistance is. Now we're going to talk about critically important antibiotics. These are the last line of defense in human medicine. When nothing else works, we turn to these antibiotics. We use some of these antibiotics on Irish farms. Our aim is to explain to you what these critically important antibiotics are and why it's so important for all of us that we reduce their usage.
So as Tommy said, not all antibiotics are the same. These critically important antibiotics are the drugs of last resort in human medicine. These are the antibiotics that we need to work when nothing else will do the job. I saw myself firsthand with one of my children when she had a kidney infection. There was only one antibiotic out of 10 that was going to cure her infection. And that antibiotic was ciprofloxacin. And I recognised that as an antibiotic that I would have used to treat pneumonia and scour in calves when I was in practice. So we really must be aware of how important these antibiotics are to human medicine and how to use them appropriately, because the reality is we should be not using them at all, or at least only when absolutely necessary.
So critically important, we keep using those words. We still can use them on farm in exceptional circumstances where there's no other option and in really working with your vet to make decisions. But my own opinion is critically important antibiotics don't have a role in Irish farms in the future. We've got to think about removing them. They might have advantages like short withdrawals or no milk withdrawals for some products, but they're critically important antibiotics for human medicine. They're the last line of defense. And that's what I want you to remember. That's a key fact, because that's why this One Health message is so important. It's the practices we do on farm, how they affect our animals, ourselves and our families.
So the reality is now that the laws around how we can use and will be able to use antibiotics in the future is going to change. By 2022, there will be stricter controls on the use of antibiotics. The key driver behind the legislation is this One Health concept to protect human health, animal health and our environment. How we use these critically important antibiotics must change. They can no longer be used routinely and only in exceptional circumstances. As farmers, you should never use them without advice from your vet, and your vet now has to adhere to a strict code in how they prescribe these antibiotics.
Caroline, you mentioned an antibiotic called ciprofloxacin, and most people won't register them. But for me, I really thought about my own experience with the antibiotic. It was with one of my children. These antibiotics are last lines of defence in human hospitals. Last line of defence medicines that we use in our farm animals. This is why they're critically important. This is why we need to, in my opinion, remove them from our farms and only use them absolutely when we need to. And that's why it's so important for this message to get out, that it's One Health. It affects everybody, doesn't it?
It certainly does, and it is vital that we know what these antibiotics are, these critically important last resort antibiotics, because they're the ones that we depend on utterly in human health. And if we are overusing them, misusing them in animal health, we will not have them to use to protect our human health. So it goes back to the One Health idea. One animal, one person, one environment. We all share the same drugs, we all share the same diseases, and so we have to use these particularly critically important antibiotics only as a last line of treatment.